First, we got to talk about who exactly is an infant. Well, we're talking about a patient that is over a month old, but under a year old. That is defined as infant. And we're talking about infant CPR, separate from pediatrics, so infant CPR. Now, first thing we're going to do, we have 10 seconds to do three things. Try to stimulate and check for responsiveness of the child, breathing, and a pulse. So we first, let's say someone was to give us the patient. We have the patient in our arms. We want to try to stimulate, see if the patient is responsive. Let's say they're unresponsive. We're trying to expose the patient's chest, abdomen. We want to see, is the patient breathing? Do we see any breathing at all? No. Okay. Then we have, in that 10 seconds, to check for a pulse. So if we have unresponsive, no breathing, no pulse, start CPR, and let's move into number 2. So we're starting CPR. Let's say we're out of the hospital and we're out in public. Now we're going to activate EMS. We're going to call 911. We're going to get some help, and we're going to find the nearest AED while we're doing CPR. I'm going to talk to you here in a moment about one rescuer versus two rescuer CPR. There is a difference. Now, let's say we're working in the ambulance and we're a 2 EMT crew. Of course, we have a partner, so we are 2 rescuers. We're bringing up our AED. We're getting the pads going while we're providing compressions. This is what you must know. So we have one rescuer with infant CPR that is 30 compressions with 2 ventilations. Now I'm going to show you a picture right here of a pediatric BVM, so you can see what it looks like. And I'm going to show you right here what the CPR grip, if you will, is going to be, the CPR method, if you will, is going to be for the one rescuer. And now I'm going to show you what it looks like for the 2 rescuer. So the way to remember it, so I wrote it down here, one rescuer, it's 2-finger CPR, and then we have, you can say the 2-handed, right? You can also think about 2 thumbs versus 2 fingers because you have 2 hands, right? So 2-handed grip, I call it 15-to-2 compression ratio is going to be for 2 rescuers, okay? Now, here's CPR tips. We are going to be compressing 1/3 of the diameter of the patient's chest. So keep that in mind. That will be at every exam. Now, 100 to 120 is the compressions per minute rate. We want to get at least 100. The real goal is 100 to 120. Now, here's a pearl. You can place some padding behind the shoulders, and I'm going to show you right here what the sniffing position is for a child. You can see it here, right? With adults, we really got to crank their head back to get into that sniffing position. With pediatrics, not so much. You put some padding under the shoulders, and it goes right into position. So that's the tip there. Now here's the bonus. What do you do if your infant patient starts to choke? How do we know it's a full obstruction? Here's how we know. No noise, no crying, full obstruction. If the patient is crying, coughing, it's a partial obstruction. So what do? Well, the first thing we want to do is we're going to approach the patient. We're going to hold the patient securely, and we're going to deliver 5 back blows, followed up by 5 chest thrusts, or some call it compression that we learned about, right? So 5 back blows, 5 chest thrusts. Here it is, okay? We're going to repeat this until the object clears. Now, here's the big thing. What if it doesn't clear? Well, if the patient slips into no breathing, no responsiveness, no pulse, you're going to start CPR, and we just learned about the infant CPR, go through all that, right? So that's the key things you want to do with a choking patient like this. If you right now are getting ready for EMT school, advanced EMT or paramedic school, or maybe you're getting ready for your national registry exams, first link in the description is lifetime access to all my prep work. Prep for school, help in school, medications, national registry, skills is all down below in the first link, and I will see you on the inside. I'll catch you in the next video.